Deputy Director for Drug Free America Foundation. The webinar is supported in part by the Florida Department of Health and is part of our marijuana pregnancy and extending to youth educational project. Before you get started, let's share a few housekeeping items. Please introduce yourself in the chat box, put your name and your organization and where you're from. We'd love to see where everybody's joining us today. If you have any questions throughout this webinar today, please place in the Q&A box. That's way it's easier to retrieve the questions at the end. A survey will appear upon the completion of the conclusion of this webinar. We'd appreciate if you could please complete. And during the webinar, we love to kick off our Next Best Gen Instagram, which you can see at the bottom here. Please post on social media, tag us, and let's make it interactive today. So today we celebrate National Substance Use Prevention Month, and it's Red Ribbon Week, and I got my red ribbon on today. This week marks a key moment as it's the largest national prevention campaign in the country. It encourages all to promote healthy, drug-free lifestyles. This prevention campaign was organized by National Family Partnership in response to the killing of drug enforcement agent Kiki Camarena. In response, parents and youth across the nation began wearing red ribbons as a symbol of their commitment to raise awareness about the killing and destruction of drugs throughout the country. This webinar today, in honor of these initiatives, we bring you a special webinar by our Drug Free America Foundation's Young Professional Advisory Board. Our members today, we're honored to have Ariel, Cohn, Emily Hill, and a special guest, Drusilla Reinhard-Blinker from Suriname, join us as our presenters. Together, these leaders will explore the evolving substance use landscape among youth and young adults, highlighting prevention initiatives across the country, Caribbean, and Latin America. So for a brief intro to our Young Professionals Advisory Board, this board is a dynamic and driven community committed to empowering youth and young adults. Our mission is clear: to promote a society where youth and young adults are equipped with the knowledge and tools to make informed drug-free choices. On this screen, you have the QR code and a little flyer, so we'd appreciate if you're interested or know anybody to scan that code. It'll direct you to our dedicated webpage to learn more and to fill out an application. Our Young Board exists to develop impactful resources and strategies that resonate with youth and young adults. We advocate for sound drug demand reduction policies and actively promote the one choice prevention message. Health goal of no use of any alcohol, nicotine, marijuana, or other drugs under the age of 21 for reasons of health. We're actively recruiting young adults ages 18 to 25, so join us. So let's move forward and hear from one of the first youth leaders in prevention. Our first presenter is Emily Hill. Emily Hill is a drug-free community use coordinator at Scott County Public Health, specializing in adolescent substance misuse prevention, mental well-being promotion, and community collaboration. With 2 years experience in the field, she has started a county-wide youth advisory committee, hosted various cannabis education presentations to around 200 youth and adults alike, and has successfully written a federal drug-free community use grant. Congratulations. Hill holds a bachelor's in global health studies, Spanish, and a certificate in disability studies. So let's welcome Emily.
Thank you, Chantel, for that introduction, and good morning, everybody. Like Chantel said, my name is Emily Hill, and I'm excited to be here today to speak with you all about this very interesting topic. There we go. Okay, so more specifically, I will be touching in onto cannabis in the United States and then focusing even further in what is actually going on in the landscape for youth and young adults related to cannabis. To start us off, the United States as a whole, what I really want to make clear is at a country level, the substance of cannabis is still illegal under federal law. However, each individual state has various programs in place and laws, regulations, things like that. So these bright green states you see have both recreational cannabis and medical cannabis programs. The off green tan color, those ones have low THC and CBD product programs in place. That dark green color, that's a medical cannabis program are in place. And then there's only 3 states left in the US that have no public program. That's Idaho, Nebraska, and Kansas. Something to point out is across each state, they get to make their own rules, regulations, and policies around the cannabis laws that are in place, whether it's medical, recreational, etc., public program. Today, we're going to focus in on one state in particular and the recreational program, so adult use of cannabis. And we're going to do Minnesota. So let me go back. So that middle central north state in the bright green. I'm from Minnesota. I work in Minnesota, and I have some data from Minnesota students today to cover what I have for you all. A quick overview of some key points of the Minnesota cannabis legislation that I keep touching on can change and vary state to state. But Minnesota was the 23rd state to legalize recreational cannabis a little over a year ago on August 1st of 2023. We were not the most recent. I know Ohio legalized after us, so they're the 24th, and I believe they're the most recent state to date. Some things to consider. So on the left-hand side, we can see possession. So the age requirement to participate in the adult recreational cannabis program is 21 plus, and that's pretty universal across states that have the recreational program in place. Some things that might vary. Looking below here, you can see in Minnesota, they allow 2 ounces of cannabis flower, 8 grams of cannabis concentrate, 800 milligrams of edible cannabis, basically the amount you can have on your person in public. Now that can be different. In New York, maybe it's 1 ounce of cannabis flower, and in California, it's 3 ounces. So things like that, the states are able to make their own laws and regulations around the program that's run in their state. Something that makes Minnesota stand out, whether for good or bad, is that box down below is in private. Minnesota made it. You can have it in your private residence in your home up to 2 pounds of marijuana. That's equivalent to about 34 ounces. And the state with the next highest limit of allowable possession is 10 ounces. Why is Minnesota so high? I'm not sure, but that's just something that makes us stand out. Some other pieces I covered in here, like the tax, again, delegating where the tax revenue is going to go. So in Minnesota, they put 80 towards the state, 20 towards local government. That'll go to things like education, prevention, compliance check expenses, things like that. The growing is different in every state. Some states don't allow it at all. Some states allow it, but with a certain number of plants. In Minnesota, they allow 8 plants to be grown in the home, 4 flowering at once. And then even the retail, so the number of licenses, the types of licenses, where cultivators, retailers can be located in the state, zoning, all of that stuff, as well as it varies state by state. They get to make their own rules and regulations. That was a really quick overview of very few points of the entire legalization. I just wanted to really take some time to give that summary and that background on what cannabis looks like in the United States, because it can be its own presentation on its own. But what we're really getting into today is that cannabis use landscape among youth and young adults, especially what's impacting them, what's making it different today than in previous years, 20, 30, 40 years ago. I first want to touch on the potency. The products of today are nothing like they were, again, back in the 80s, 70s, even the 90s and early 2000s. This graph here is depicting the percent of THC and CBD in cannabis samples seized by the DEA. So THC is the psychoactive part of the plant, the part that can make a person high, and CBD is that non-psychoactive part of the plant, the part that's not necessarily going to make a person feel high. The blue line here at the bottom of this graph is showing the levels of CBD in the sample products across the years, which stays relatively similar. Where we can see the difference is that in that red line, that's depicting the percent of THC in the product. And you can see it has increased by five times since 1995 to 2021. Even previous years, on average in the 70s and 80s, the potency of these products was around 1 to 3%. And today it's even as high as 20%, especially here in Minnesota. We're at a higher average of THC in our product than at the national average. But flower today can be up to 30% potent, and they can even make some waxes up to 90, 99% THC through synthetic processes. This has a huge impact, especially on our youth, and just in the terms of the strength of these products. What the youth are consuming is much stronger, that can lead to so many different health risks, complications, and even increased risks of addiction. and among various things. Again, a whole nother presentation, but just something I wanted to point out, that that's a different thing about the landscape, and that's our biggest thing we're trying to educate parents and community, is how this is not what they maybe did when they were a kid. Maybe when they were a kid it was fine, but today it is not the same product. Another point that really speaks to the landscape is the ways that you can consume marijuana. It has expanded to many products. There's still the traditional blunt and joint, bong and bowl to smoke cannabis flower. But in addition to that, they now have seltzers that are infused with THC. They have vapes that come in various sizes, shapes, and flavors. You can consume it by eating, whether it's gummy, chocolate, anything you can eat, you can infuse with THC. And even topicals and tinctures, things you would think of for self-care, for your skincare routine, can be infused with THC, and people can use that to get high. These again are targeted towards youth and young people. It's appealing to them. It's easier for them to use. You can eat a gummy anywhere really, in your car, at school, etc. You can drink a cannabis seltzer at a family barbecue. You put a koozie on it and people don't know if it's an alcohol seltzer, if it's just a lemonade, sparkling water, if it's THC infused. And even vaping, it's normalized to vape really anywhere. I was just at a football game and people were vaping all around me in the stands with everyone else around them. The smell and the taste, all of that's covered up, taken away, and into these different ways to actually consume the product that just really makes it more appealing, especially for young people. Pulling us out a little bit to just some data pieces to see how this is starting to implement and impact our youth and young people in Minnesota especially. So Minnesota surveys their students every 3 years. They survey 5th, 8th, 9th, and 11th graders on various topics. I just pulled out the cannabis ones for the purpose of this presentation. But this one specifically is asking the students, on how many occasions in the last 12 months have you consumed cannabis? These are the reports of grade levels that had consumed one or more times in the last year. So 0.7% of 5th graders across Minnesota, up to 4.3% of the 8th graders, 6.6% of 9th graders, and then a huge jump to 16.9% of 11th graders, at least once in the last year. And again, this data was collected in 2022, so pre-legalization. What I really want to point out here is people are starting to get into these products at younger and younger ages, especially in middle school, and then that huge jump in high school, and especially upperclassmen, again, from these availability of these products, the ease of these products, and it's not as intimidating to eat a gummy as it might be to smoke a joint or a blunt. So that's really why we're seeing these numbers start to grow in our younger grades, our younger populations. And again, that has so many health complications and factors and risks. The younger you start to use, there's so many different complications that can happen. Another aspect that you cannot ignore when speaking about the landscape, especially for young people, is social media. It is most social. I myself am on all 5 of these social medias I'm depicting, and most youth probably are, and even more. From Snapchat, where people often are selling their products, to educational videos on YouTube, the Instagram accounts that make it look chic and cool, even humor on Twitter or X, and they even sell cannabis products on TikTok Shop. Even anywhere online you can deliver or can order for delivery cannabis products to your home. But again, whether intentionally or unintentionally, youth are coming across these posts, coming across these videos, having the availability and ability to purchase online these products, and that's really increasing what they believe their peers and people to be using. People only post the good stuff on social media. Well, that's what the youth are seeing is the good part of using cannabis, the fun part, the educational part, and that can affect their perception of what's actually going on. Again, if we look at that Minnesota student survey data, we can see here the bar graph down below is showing the actual reported use of cannabis, and the line graph above is showing the perception of use among their peers. To simplify it, we're going to look down here at the bottom right-hand corner, the daily bar graph and this brown bar is showing us 2022. So you can see about 3% of 11th graders in Minnesota reported daily use of cannabis. But those 11th graders believed around 16 to 17% of their peers were using cannabis daily. That discrepancy between what's actually being used and what they think people are using can really harm them as well, in terms of thinking that it's the norm to use cannabis, to engage in use. So when they're confronted with that opportunity or that decision, whether to choose to use or not to use, maybe in their minds, that is the normal thing to do. That is the cool thing to do. That's the thing everyone is doing. One last aspect of the landscape, and this is especially for states with legalized recreational marijuana and the ones who are in the process of it, or even the ones that don't. If you look in that upper left-hand corner of that billboard, it's advertising weed is legal in 60 miles. Again, like I talk about, the laws vary state by state. So maybe you're in a state that doesn't have recreational program, but you drive 60 miles and now you're in a state that does. If you're 21, you can purchase the product. Again, I have down below that is a tobacco shop. It's on the main street in one of my the cities in my community, and it's right next to the post office. And then I zoomed in on the window where it has marijuana leaf advertisement. It has a written advertisement for cannabis products. Just kind of showcasing that message. Maybe people are passing that on their way to school. Maybe people are going to get their passport renewed. There was restaurants and other things on, again, this is the main street in this city, in this town. And just that messaging is everywhere for people to consume, whether it's on the billboard, whether it's in the store. Even here on the left-hand side is showing you a THC section. This is specifically of the liquor store, but having a section dedicated to cannabis. Now it's coming in to places that especially young adults who can enter and purchase alcohol are starting to see it more. It's becoming more normalized. Even in Minnesota, they have a low potency hemp edible law as well that's separate. So these edible gummies at certain levels can be sold in our gas stations, can be sold in our grocery stores, can be sold in places that especially youth and young adults frequent often. And they're, again, seeing these products becoming numb to the idea of becoming normalized. This is the community culture. This is the community norm. This is what people do for fun. This won't harm me. The middle one here is an event that just happened in September in my hometown, Doobie Dabbler, it was called. And this is, you can see it's at the Seavers Festival ground. So that is a typical fall festival, pumpkin patch, corn maze, an event for the families. Well, before they kicked it off in the fall, they hosted a cannabis event there the weekend before. So it was a music festival, but it was also had a ton of cannabis vendors, cannabis cultivators, growers, excuse me, all there to sell their product, to get their product out to the music goers of festival. But again, just by the name, the whole entire festival revolved around the substance of cannabis, even though there was music, even though there was food. And maybe the youth and the high schoolers, they're not going to that because you have to be 21, but maybe their older siblings are going, their parents are going. It's, again, in their community being advertised. And just that normalization of this substance in our community, again, is going to affect young people, and especially their perception of harm and risk. And that's my last data point here from the Minnesota Student Survey. They specifically asked, how much do you think people risk harming themselves physically or in other ways if they use cannabis once or twice per week? In 2016, across all students surveyed, 58% said, yes, that's a moderate or great risk to me. It decreased in 2019, where only 53% said, yes, that's a risk to me. In our most recent survey, 2022, we are under half of the student body. Only 49% of students thought that using cannabis once or twice a week was a risk to their health. Again, this is in 2022. This is pre-legalization. Minnesota did not legalize cannabis until 2023. So we have the survey coming up again in 2025 this spring. So we're waiting to see what the results are now that the actual narrative has passed and been pushed into the conversation, into the communities over this last year or so. Now, I didn't want to leave off on a bad note, so I wanted to turn it around, turn the narrative, and discuss some prevention initiatives, some things that we've been doing in our community to raise awareness around this issue. So these are just some pictures, but the main takeaway is to target everyone. Not only are we teaching youth, not only are we training our youth advisory committee and having them do peer-to-peer education, but also targeting the community, going out to community events with our resources, our materials, our education, targeting our partners that we work with, and just educating them, teaching the teachers who spend all day with the students in school, going to them and presenting about the law, what it means, what it could look like in their classroom. And then especially most importantly, targeting the parents. Parents are our biggest advocates in prevention. They're the ones who are the biggest role models for our youth, for our young people. And just showing them, especially that the product is different today than what it was when they maybe were using in the 70s, 80s, and they had one or two joint and it was easy to let go. Today is much more powerful, much more addictive qualities, and just not the same thing. And just making sure they know the truth, along with the students and the community, and then together everyone's efforts can come together to make a difference. I just wanted to leave you guys with the last words that prevention does work. It does take community, but it does work, and it will work as well. That's all I have for today. Thank you, everyone. I will stick around for a Q&A afterwards.
Wow, thank you, Emily, so much. I mean, just so many things stuck out to me, and just showing us how what's going on in Minnesota, how the industry is targeting our kids. You're right with the concealing of these different methods of consumption. You know, it is intimidating versus a child, like if somebody, a youth, teenager, whatever, young adult, if they didn't want to like smoke a joint and have that coughing or whatever effect, and now it's so easy to consume a gummy and vape, and it's just being concealed. And so you're right, everything that you said, the visibility, normalization, and thank you so much for all the work you're doing on the ground and the targeted audience of the diversity. And it's so important to get that information out and combat the industry's messaging. So thank you so much. So now we'll move on to Ariel. Cohn is a prevention supervisor with DCCA, a nonprofit organization in Kansas, and she works in substance use prevention, mental health promotion. Her primary fields of focus are youth tobacco use prevention and youth suicide prevention. She graduated from the University of Kansas, where she earned a degree in community health, a minor in applied behavioral sciences, and a certificate in leadership studies. Ariel is a certified tobacco treatment specialist and is a trainer in youth and adult mental health first aid, sources of strength, and substance abuse prevention skills training. So welcome, Ariel. Oh, I cannot hear you. Try speaking now. Oh, oh.
What about now? Can you hear me?
Yes, perfect.
Sweet. Okay, sorry about that. I am taking some time to talk to you all a bit about the vaping trends that we're seeing. I am from Kansas, so I'll be talking a bit about what we're seeing in Kansas and in terms of youth vaping, but I'll also take some time to talk about what we're seeing in the entire United States as well. So just a brief introduction about DECA, the organization that I work for. We provide a whole host of different services for the entire state of Kansas, namely the behavioral health services for folks with a substance use disorder. And I'm coming to you all from our prevention services, so focusing on that substance use prevention, suicide prevention, opioid use prevention, all sorts of things like that. So just a little bit of background on vaping. So you can see here on the left-hand side, this is what a typical vaping device looks like. They've got a cartridge, and that's typically where that like juice or e-liquid is. So that's where like that nicotine is. As Emily was saying, some folks are able to vape cannabis, so that would be where the cannabis liquid is sitting. And then that's where folks are able to inhale. Then they've got the atomizer, which is that heating element, sensors to show the users when to inhale, when it's working, that sort of thing. And then the battery, which makes it run. Some products are disposable, so once the juice runs out, they just toss it. Some of them are refillable or rechargeable, so you can purchase just the cartridge piece of it and connect it that way. So there's all different types of products out there. They don't all look like this. Some of them might be bigger, some of them might be smaller. There are so many different types of products. So many different companies are able to make vapes look like different things as well, which I'll get into in a moment. The main concern is that with nicotine and tobacco products, first of all, inhaling all of those chemicals can be really harmful to our lungs, especially in young people when their bodies are still growing. There's also the concern of bringing all of those chemicals into our brains, again, when their brains are still developing. Even after our brains are done developing, having those chemicals coming into our bodies and into our brains can have permanent damage on our ability to think, make decisions, remember, things like that. And then, of course, the addictive aspect of those nicotine and tobacco products, even just using nicotine one time can build that dependence on that substance, leading youth to use those substances more frequently, which is, of course, a concern. Next, I do want to talk briefly about the marketing. So here you can just see an example of what some marketing from the company Juul looks like. Juul is one of the most common vaping brands that you might see or hear about. This is just an example of a launch party ad. So of course you can see they're using those bright colors, young people, and having a launch party. Typically adults wouldn't want to attend a launch party around an e-cigarette or a vape. So this is definitely one example of the way that tobacco companies are targeting our youth, our young people. The reason why that's so concerning is because youth oftentimes don't know that there's nicotine or the harms of these products. Oftentimes I'll hear young people say that they think it's just water vapor, so it's not harmful. Of course, we are doing a lot of education, which we'll touch on a little bit later, to help provide students and young people with that correct information. But with those marketing tactics, in 2021 in the United States, tobacco companies spent $8 billion in marketing. So they are pouring so much money and time into these marketing efforts to attract young people. They do this by creating fun flavors that youth would be attracted to, using those bright colors, creating ads with young people having fun, hosting events like these launch parties, doing anything and everything that they can to bring those young people into this space. And there is a quote from Lorillard Tobacco Company. Lorillard Tobacco is the company that created Newport cigarettes, and then they also are responsible for the Blue e-cigarette brand. And they have a quote stating that the base of their business is the high school student. So they are knowingly marketing and targeting our young people, at least in the United States, to try to get them hooked on their product because they need those lifelong customers to keep their business going. And then lastly, vaping, according to the U.S. Surgeon General, I believe this was in 2022, named youth vaping as an epidemic because of the addictive qualities of nicotine and because of the rapid increase of vape use that we saw in the United States. So it is considered an epidemic. We have seen overall, we're starting to see a decline in the use of vaping. Hopefully that's due to our prevention efforts, which we will talk about a little bit later, but just wanted to give some brief background on that. So first, I want to take a look at some local and state data. So I'm from the state of Kansas. I work in Douglas County, which is where the University of Kansas is. So we do have a whole bunch of college-age students, but outside of that, we also, of course, have we have 13 middle and high schools in our county, and a whole bunch of we have some like private schools, some elementary schools, things like that. So this is data from our Kansas Communities That Care survey. So this is just a student survey that goes out to 6th, 8th, 10th, and 12th graders, and it goes out every year. So here we see the first question: have you ever tried vaping? We didn't include this question in the survey until 2021, which is why you're not seeing previous data from that. And of course, with Douglas County, we're having some issues getting that survey into the schools, which is why we're not seeing that data for 2023 or 2024 yet. But to take a look, so for students who tried vaping at least once, in the state of Kansas, it's right around that 19% and in Douglas County, we see in 2021, it was 18%, and actually dropped in 2022 to 14%. And then looking at how frequently students vaped in the past 30 days, students who responded at least once. So we're seeing about 5 to 6% for Douglas County, and then around 6% for the entire state of Kansas. So in the past 30 days, only about 6% of students are vaping at least once. And then here, looking at the average age of when youth first started vaping, you can see here it's around 13, 14, which is pretty concerning. Again, thinking that nicotine tobacco isn't legal until the age of 21. And again, like we talked about before, the permanent damage that it can do to our bodies and our brains, especially for the young people who may not know what those effects or what those repercussions might be. Again, this is just looking at the perceived risk of harm here. So how much do you think people risk harming themselves if they use vaping products someday or every day? And so the response here is if the students responded any measure of risk. So here we can see that the majority of students, both in Douglas County and the state of Kansas, do believe that there is that risk of harming themselves, which is important for us to know. As we continue to do our work, that for the most part, students do understand that risk. So seeing what other education, what else we need to do to help with that. And then also I wanted to include this piece, how easy would it be for you to get vaping products? And for the students who responded very easy, we can see we're at about 15% of those students for the county that I'm in, and then 13, 14% for the state of Kansas. And this is really important, especially looking at my county specifically. So our county has about 120,000 people in it, and we have about 80 tobacco stores in just our county. So when we think about how many stores, how many retailers are out there selling that tobacco, those nicotine products, it's important for us to see that a fair number of students believe that it would be very easy for them to get those products, which I'll touch more on in just a moment. So here we have our local data. So I conducted a focus group back in the spring of 2024. And these are just overall themes that we saw in the survey or in the focus groups that we conducted. We conducted 6 different focus groups. We had about 71 students participate. Some barriers to getting help around substance use include that fear of being punished or disappointing family members, denial of the problem, or belief that substances help with mental health. The reason why I wanted to talk about that is because a lot of young people, from what I've heard in my work, is that they use substances, namely that nicotine, sometimes that THC, that cannabis, as a way to cope with mental health challenges. So one thing that we've been doing a lot of education on is alternative ways that we can cope with mental health challenges, that we can get that help for mental health outside of substances, and also explaining that in the short term, these substances can trick our brains into thinking that they are helping with mental health when we know that in the long run, it's doing a lot more damage than good. So continuing to share that message is something that is important to us here. We also noted that students use vapes in school bathrooms, in their classrooms, locker rooms, in the school parking lot, in their homes, in their bedrooms, with their friends, and at parties as well. The one thing that's concerning, especially is those vaping in the classroom. There's something that some students will do called stealth vaping, because sort of like Emily talked about with vaping the cannabis, there is often like a fruity flavor or no flavor at all, right? So it could be, or no scent at all, which can make it difficult to identify if a student is vaping in the class. And also a lot of students will do the stealth vaping, which means they'll take a hit of their vape and then they can exhale into like their sleeve or in their collar, so that there's like no aerosol or anything that even comes out that is seen by other people. So stealth vaping is certainly something to pay attention to think about, to ask your peer or to ask your students, to ask the teachers, other school staff to see if that's something to be concerned about. And I do think vaping in bathrooms seems to be a pretty common thing across the board, not just in my county, but in the entire country, because it is a place where there aren't cameras. Oftentimes, if a student goes into a stall, they're able to have that privacy so they won't get caught. And oftentimes students will, plan to go to the bathroom together with their friends so that they can vape together during those times. They also noted that they typically get these tobacco products from older friends, siblings, and parents. The important thing to note here is with parents, some parents are purchasing these tobacco products for their youth, and some young people are stealing or taking them from parents or siblings. There was also one school that I conducted this focus group, and they shared that some of their peers have fake IDs to get this tobacco, to get these products, or they know which stores will check for ID and which ones won't check for ID. And again, because we have like 80 different stores, students are able to figure that out and pick and choose what locations they go to get that product. And we are doing some pieces as well with that tobacco retailer education as well, which I'll talk about later. About half of all students said that their family does have clear rules against vaping. So that's another thing, encouraging families and parents to talk with their children about vaping, because at this point, every student is exposed to it in one way or another. So the best thing that we can do for our children, for the young people in our lives, is to have that conversation, to be open and transparent and let them know what like the family or rules or expectations are, and also having that conversation, letting them know that they have adults that they can turn to if they need that support. And then all of the schools mentioned that vaping was the most widely used substance in their school. Second and third substances were that cannabis, alcohol. Those were the main top three, but vaping was certainly the most common across the board. I do want to take just a quick moment to look at some national data as well. So looking at the entire United States, about 22% of US students reported using any type of tobacco product in 2023. So that could be vaping. That also includes nicotine pouches. It also could be chew tobacco. It could be cigarettes, things like that. But to have about a quarter of students using tobacco is certainly concerning. Again, e-cigarettes are the most commonly used tobacco product. Again, there are other products that some young folks might use, but e-cigarettes are the most commonly used. And then 90% of youth who vape use flavors. So that again just sort of supports that idea that those flavors are targeted towards youth. And I know there have been some flavor bans in some areas, which has certainly helped decrease that amount of youth use, but there's still more work to be done. This I just think is something interesting to think about. So reasons why youth try vaping. More than half of the students in the US said that they tried vaping because a friend used them. Another almost half said that they were curious about them. About 25% did try vaping as a way to deal with whatever mental health challenges, and then some folks to get that high or buzz from nicotine. And then the reasons that youth continue vaping, you can see here almost half of them continue to vape because of those mental health challenges. So again, that supports what I had mentioned earlier about using that substance as a way to self-medicate, and the fact that it does more damage than good there. And then with that, students will continue using it to get that higher buzz from nicotine. Again, that goes hand in hand with that trying to cope with mental health challenges. And then about 28% continue vaping because their friends use them, so maybe some of that peer pressure. And then one interesting thing is 20% of students continue vaping because they can do tricks. So just another piece of youth vaping. So looking at some of the prevention efforts, some things that are going on in our community, and that other communities across the country are doing as well. That education piece, so spreading awareness and education around the harms of vaping, and helping to empower young people to make those smart, safe decisions. We do that through presentations in schools. We host different events, programs, activities that we try to make them fun and also have that education piece. So providing that safe space for youth to be curious and have that conversation. Again, youth groups, Emily touched a little bit on the youth group work that they're doing in Minnesota. We also have some youth groups. I host a youth group just in our county. They focus on that substance use prevention and suicide prevention work. And so the students actually create campaigns, projects, activities. They plan them and they pick sort of like a topic. Oftentimes they do pick that vaping piece, and they put on this event or program or campaign for the rest of their school. So they are sort of the experts in their school, and they share that message with the rest of their peers. We also have a statewide program through the Kansas Department of Health and Environment called Resist. So it focuses on tobacco prevention advocacy at the state level, at the government level. So students get to go be a part of that and advocate for stricter policies, which is cool. And then lastly, a vape disposal box. This is something that's relatively new on the scene, but we are starting to see more of it. It's something that we currently have implemented in 2 of our schools. A vape disposal box is basically just a little lock box that you can put on the wall of a school or any other location. And students are able to go and drop their vape device in that box without any fear of getting in trouble or punishment. And then when they do drop that box in there, they also are able to grab a quick kit that has things like Tic Tacs, fidget toys, motivational notes, a list of resources for more support, that sort of thing. So that is certainly something that we just recently implemented a few weeks ago. So we're excited to see how that might affect youth use or youth getting that help to quit. So some next steps, what we can continue doing in this field of vaping, continue the efforts, continue that prevention, what we're already doing, and continuing to spread it, especially to parents. I think it's a lot easier to reach youth sometimes, but it's also important that parents and caregivers are knowledgeable and aware of the situation and helping educate their young people in their lives as well. Continuing to do research because vaping is so new. We need to collect data and conduct that research to prove the harmful effects that vaping has. Just like with cigarettes, we did years and years of that research to be able to prove the long-term harmful effects of cigarettes. So unfortunately, just saying that the vaping is like cigarettes is not enough. We need that actual data. So conducting that data so that we can prove that as well. And then providing support. We want to provide resources to quit and that support for quitting so we can help those young people choose that tobacco-free lifestyle and help them make the best choices for themselves. That is all that I have for you all. My email is there if you all have any further questions regarding anything that I discussed today, but thank you so much for taking the time to be here.
Thank you so much, Ariel. You just touched on so many good things. What really stuck out to me was that quote from that Newport company about the base of the business is the high school student, and seeing the marketing, and like Emily showed, the marketing that is focused to youth. It's honestly disgusting, especially since all what we know about the harmful chemicals and how they're developed and how it harms the developing brain. And I love the work that you're doing locally on the ground, just like Emily, with your focus groups, because it is important to understand why youth are using and to target that as what we can do for prevention. And one huge area is only half of families have those vape-free policies or whatever or whatnot it is. And families are such a huge protective factor. So that is critical, like you're doing, is educating and getting those families involved in understanding. So thank you so much for all your work you're doing. And then we will move on to Drusilla. Let me pull up her presentation. And then Drusilla Reinhard-Blinker, welcome. She is a passionate advocate for empowering vulnerable communities with a focus on youth development and drug use prevention. Her journey began with peer education and has expanded to international advocacy, including presenting at the Caribbean Youth Forum on Drug Use Prevention, the 24th Experts Meeting on Drug Demand Reduction in Panama, and CCAD's regular session. Drusilla has also secured grants for prevention projects benefiting at-risk youth. Professionally, she serves as Quality Assurance Manager at the Loving Hands Foundation and Director of the SIH Youth Initiative, where she leads youth programs and develops impactful projects. With a background in psychology and educational science, Drusilla blends research and practice to create lasting change in her community. So welcome, Drusilla.
Thank you very much for the introduction, Chantel. First of all, I want to compliment my co-presenters on their presentations. So they were very insightful, and I got a lot of information on, what is happening there in the U.S. I want to thank you, the Drug Free American Foundation, for the opportunity to contribute to this webinar. So today I'm going to share my perspective on like the drug trends affecting youth and young adults in Latin America and the Caribbean. And I just added a quick title at the top, Let's Create an Echo. This is something that while I was working on this presentation, something that I thought was very important to add. And I added this because I want to encourage all of the young people who are taking part in this webinar to actually create an echo. And when I say an echo, what do I mean? The thing is, most of the times we complain that young people are not being included, young people are not being considered or taken into consideration when it comes to policy, and their ideas are not being heard. But I feel like if we as young people, even if it's one event, one person at a time, we make an impact, we can eventually create an echo, because when you have made an impact somewhere, there's someone who's going to remember that and going to share that, and eventually it's going to create a bit bigger impact. So that's why I decided to add this as a title for us as young people, as this is a webinar consisting of panelists who are young people. So if we take a look at the next slide, you guys already got a little bit of information on me, but specifically, I just wanted to add, I do work for Loving Hands Foundation and function as the director of the Youth Initiative, and I am a youth leader who has represented my peers in Latin America and the Caribbean. I am the focal point of the Declaration of Oviedo, which is the Global Prevention Declaration. But my most important job, as I always state in any presentation and anywhere I go, is being a mother. So we're just going to quickly jump into the content of what I want to talk about today. And if you take a look at this slide, you see a pie chart representing the estimated drug use among youth in Latin America and the Caribbean for 2024. And this highlights the prevalence of cannabis, cocaine, synthetic drugs, and opioids based on current trends. So if we take a look at opioids, you see that stands at 10%, synthetic drugs at 20%, cocaine use at 30%, and cannabis use at 40%. And I wanted to give you guys an indication of what it looks like. There's definitely a lot of different substances, but the reason why I wanted to highlight this is because we see that cannabis use is significantly higher than other substances, and there is a very good reason why I really want to dive into cannabis use. We've noticed that lately in the Caribbean and Latin America, in many different countries, but it's becoming a big trend here that governments are working on the legalization and decriminalization of cannabis. And the thing is, we had this discussion in Greece at the ISUP meeting where youth are not being taken into consideration. The way that youth are protected when it comes to passing these laws, there's nothing being put in for that. So that is something that I want to focus on today. If we go to the next slide, I'll give you an overview of cannabis consumption. I think Emily touched on that in what happens in the US, but in the Americas, it takes several forms with a growing variety of methods. And this is thanks to availability and legalization. So I highlighted availability and legalization because these are two very important factors when it comes to you having access to substances and being able to consume these substances. We have smoking, which is something that everyone knows about. And then we have vaping, which is gaining popularity amongst young people specifically. And then we have edibles. And these include gummies, brownies, and beverages infused with cannabis. Like I've seen cannabis infused popcorn, I've seen lollipops, I've seen so many different things that I find it's very concerning because they think of so many different ways to infuse cannabis into, and sometimes you don't even know that that's a possibility until you see them sharing it on Facebook. And something that I've seen recently coming around is weight loss pills that are actually cannabis infused. I did not know that this was a thing, but I've seen this, and it's actually being promoted on various social media platforms, and people who are actually looking for alternative ways to lose weight, especially young people right now who are so concerned about the way they look and very self-aware. I think this is a very big cause of for concern because there's no regulation when it comes to that. There's nobody actually trying to figure out where this is coming from and how this is actually being promoted or allowed to be promoted on these networks. We also have dabbing and concentrates, and this involves vaporizing highly concentrated cannabis extract known as dabs. This is less common among casual users, but it's growing in popularity among youth seeking stronger and faster effects. So if we take a look at the next slide, I looked for some data, and this is something I shared also during the 25th group of experts, the OAS group of expert meeting. This is an overview of cannabis legalization and decriminalization in Latin America and the Caribbean. Because as I stated, this is something that is growing, and there are many other countries working on it that are not stated. But we see this that there's a lot of countries who are already at the point of legalization, medical use, and decriminalization. So these are just the countries to give you an overview of what it looks like right now. And I know that there are other countries that are working on passing these laws, as Suriname is also one of them. And this is the reason why I've taken it as a cause for concern, because I have not noticed anything being said about the protection of youth. So because of this, I have some points in the next slide that actually are things that I stated or put together with my colleagues from Latin America and the Caribbean to give governments an idea of how youth can be protected when it comes to this. So it's important for governments to take a look at setting clear legal boundaries and consequences. So if we have a well-structured legal framework that restricts young people access to cannabis and we enforce regulation, it can reduce use among young people. We've seen that with various substances, alcohol, tobacco, putting age restrictions. It does not guarantee that they will not, get their hands on these substances, but it can reduce use among young people. And if you take a look at marketing control, I think it's very important. It's something that my colleagues already stated. I think Emily and Ariel already touched on this, that these substances are being advertised via through various networks, and usually they're catered toward young people. Because when I'm scrolling on various social media platforms, I see certain things that my parents will not. because they are not advertised toward their age group, but they're advertised towards young people. So it is important to look at marketing control and make sure that we reduce exposure and temptation when it comes to these substances. Public awareness and education campaigns are something that are is already done in a lot of countries, but something that I think we should really focus on is the impact on the brain development and mental health. Because usually, when you tell young people, don't use this substance, don't use cannabis, don't use tobacco, it's harmful for your health. They're like, okay, but there's a lot of things harmful to our health, and you have others who are going to make it come to compare. There's others who are going to compare and say, hey, but my grandfather used this and this substance, and he lived until he was 90. He was fine. He wasn't sick or anything. So it's important to give these young people this information on how it affects brain development and mental health. And you're always going to have some young people, especially when you go to schools and work with this age group, the adolescents, they're always going to have something to say. And in extreme cases, when they give extreme examples, we give extreme examples also. So something that we sometimes use is, if I had a glass with a certain substance in here, juice or something, and I let you know right now that this glass containing juice has certain substances in it, it has poison in it, and if you use it, you can get incredibly ill and even die. And I place it on the table. Having this knowledge, would you choose to take this glass and drink from it? And this actually gives them the opportunity to really think about the statements that they're making, and actually give them a chance to think about why it is important to take the risk into consideration when using certain substances. So school-based prevention programs, that's something that's also very important. And this is to help teach students about the risk of substance use and to promote life skills. Promoting life skills has proven to be very effective when it comes to substance use prevention. So in the next slide, we have a few other points, like access to mental health services, promoting healthy lifestyles, family-focused interventions, parental involvement and supervision, positive peer influence, educational engagement, emotional and social skills, and strong community. So all of these things, it's not only focused on these young people, but it's focused on their environment and everything surrounding them. Because usually when we take a look at substance use prevention amongst youth, we're usually trying to figure out, like, okay, so how can we engage youth? How can we focus on youth? But usually forget that most of these young people, they're part of certain environments, and if their parents or their family members use certain substances, how do you reach these young people? It's important to make sure that you include everyone. So if you take a look at the next slide, I want to give you guys a few youth-led prevention initiatives. I included this picture because I presented most of these youth-led initiatives during the 24th group of experts meeting, and it is to give an indication that there's not only negative things going on, because usually when we take a look at social media, we paint this picture that most of the young people are engaging in substance use, are engaging in criminal activities, but that's not the case. You have enough young people in various countries working very hard to engage their peers in positive activities. So that's why I wanted to share a little bit from various countries. I could not include all of them, but I wanted to share a little bit with you guys. So if you take a look at the first one, we have Antigua and Barbuda, and we have a young person there, Esquire Henry, that has the project Decryption, and this is a club that creates a safe space for young people from 11 to 14 to interact with each other, and also teaching them life skills which are useful in our society. If we take a look at the next slide, so we have Argentina, and then we have two youth-led NGOs who actually gathered expert activists and engaged youth to discuss the current drug scenario in Argentina and put forward concrete actions to confront the drug industry. So they actually, discuss with people from the government and people from various walks of life to get their input on what's going on in Argentina. So if you take a look at Barbados, if I'm correct, yes, we have the YMCA Barbados, the Young Leaders Program. And this is a 12-week program covering several units. And this includes leadership and soft skills, public speaking, community project, financial etiquette, literacy project. So there's various life skills that they teach these young people to engage them, in positive activities. So the next one we have Brazil. So I'm very happy to share this because I met Gabriela, who's actually the person leading these activities in Brazil at the third Global Youth Forum in Abu Dhabi. But this year we were able to work together during the fourth Global Youth Forum, and she's actually doing an amazing job there in Brazil. So they have weekly classes, and these classes are for young people aged 13 to 15 who live in the vulnerable communities. They call that favelas. And these young people, they can either struggle with substance use and misuse, but also because they're part of this community and most of these people rely on the people selling these substances, they're just there. So it's important for them to be involved in positive activities. And it offers them different courses with the goal of providing them with opportunities to have a better life. So there was a Congress on Substance Use Prevention, Treatment, and Social Reintegration, the Free Mind Congress, and then they also had the Engaging Youth in Prevention Curriculum National Training. In Guyana, we have my friend Asante, and she and her team came up with Zumba classes. So it's like an after-school program where young people are engaging in Zumba classes, but at the same time, they teach them the risk of substance use. The next slide, please. We have Trinidad and Tobago, we have Jamil, and this is actually a youth club where they do sessions on substance use education, and they are included in sports, social gatherings. They have parent meetings, homework centers, and also field trips. And lastly, I wanted to touch a little bit on Suriname. Oh no, Peru. We also have Peru. Of these organizations, there were 4 organizations who did a training, and one successfully completed the entire course and carried out the implementation of its project with children in vulnerable communities in the suburbs. And the next slide is Suriname. So we have various programs that we run, and one is a training in which young people are equipped with various life skills in combination with sewing lessons, and this promotes entrepreneurship and helps these youth in making healthy life choices. So this is a project where young people come in and they're being taught, like they can learn how to make bags, they learn how to make pants, they learn how to make various different things. And they also get once a month, they have these life skill sessions where they learn about coping mechanisms, about mental health, and all of these things. And we're actually very proud of this project because we've had a business organization actually donate an amount of money to actually buy the material that we need to have sustainability in this project so that we will be able to do this for many years to come. We also are engaged in the SAD project, which is Students Against Destructive Decisions. So we are a part of that. And then we have the I Am Special program that was developed by the director of Loving Hands Foundation. And this is a combination of like counseling sessions and health and life skill lessons. This is to make sure that, this is a would say a holistic approach to whatever these young people are going through. So this is what I wanted to share with you guys a little bit. There's a lot more, but if you guys need any more information or want to know more about what's going on in the region, you guys can contact me. My contact information is here. And thank you very much for the opportunity to be able to share this with you.
Wow, thank you so much, Drusilla. It was your presentation, again, like Emily and Ariel, just you guys are doing such amazing work, and showcasing your work on the global level and engaging youth on the policy matters is really important. I love how it's so important, especially like you highlighted, is not just educating, but incorporating like those life skills and those examples where Zumba classes, the sewing, I mean, all these different programs can be implemented, and it's such important, and what a great way to get youth engaged. And I love how it all comes together with a statement, let's create an echo. And we will continue to do that and highlight and showcase that message. So I want to thank everybody for joining us today. And again, thank you so much, Ariel, Emily, Drusilla, all of your amazing work. You guys are inspiring leaders. If there's I don't see any questions in the Q&A, and great comments in the chat box for each of your presentations. Does anybody have any Q&A before we end? We will send out the link to the recording, the presentations, if our presenters will allow, their contact information, a certificate of attendance, and then information if anyone's interested in joining our Young Professionals Advisory Board. We'll send that out, and don't see any questions come through. All right, well, I just want to thank again, everybody. Thank you again, Emily, Ariel, and Drusilla, and everyone for joining us today. Everybody help celebrate Substance Use Prevention Month and Red Ribbon Week, and have a wonderful weekend.